Good afternoon. Thank you for being here. I'm Dr. Craig Goforth, Chairman of the Madison County Board of Commissioners. I'm joined today by Hot Springs Mayor Abby Norton, Marshall Mayor Jack Wallen, Marseille Mayor John L. Chandler, Madison County Manager Mark Pulliam, Madison County Health Director Tammy Cody, to my right. Madison County Sheriff Buddy Harwood was on his way over but got called into an issue with a judge. Madison County Emergency Services Director Caleb Dispenza. Madison County Emergency Management Coordinator Lewis Roberts, to my right, and Norris Gentry, one of our county commissioners, to my left. Today we're come together to discuss the actions that are underway in Madison County and what steps we are taking to prepare for the COVID-19. We will be taking questions from members of the press at the end of the session. I'm now going to turn the floor over to Mark Pulliam, our county manager. Mark?
Thank you, Chairman Goforth. I appreciate the opportunity to be the county manager and serve you here. So in response to the emerging threat of the COVID-19 disease, Madison County Board of Commissioners, in conjunction with the town of Hot Springs, the town of Marshall, town of Mars Hill, the Madison County Board of Education, and Mars Hill University, declared a local state of emergency on March 13, 2020. Our goal is to do everything possible to reduce the number of cases of this disease in our community. We are asking for your help to achieve this goal. You may ask, why are we asking for your help? The simple answer lies in the recognition that our nation's healthcare system may not have enough critical care facilities to handle the widespread outbreak of COVID-19. Our part as citizens, simply put, is to do our part to help stop the spread of this disease. And in doing so, we are helping ourselves and helping our fellow citizens. The local state of emergency declaration activated our Emergency Operations Center. The leaders of this community have been working around the clock to continue providing essential government services during this crisis. Our goal is to protect the lives of the citizens of Madison County and to recognize that certain individuals are more prone to this disease than others. For example, Madison County Senior Services and our Community Services Department began delivering meals to senior citizens on March 16, 2020 to their homes. We will continue this service until the state of emergency ends. We have an important resource that we'd like to announce and we have made available in Madison County. It's a hotline, and the hotline number is 828-649-0755. And I'll repeat that, 828-649-0755. This hotline is open 7 days a week from 8 a.m. to 8 p.m. We encourage you to call if you have questions or have an unmet need. The hotline is staffed with registered nurses and county staff to assist you. For more information, please visit our county's website at madisoncountync.gov. I'll repeat that again, our website, madisoncountync.gov. With that, I'll turn the floor over to Tammy Cody, our Director of our Health Department.
Thank you. Madison County continues to prepare for COVID-19 infections. COVID-19 is a serious respiratory infection. We've been working with state and local partners to prepare for COVID-19 since the beginning of January. We would rather be over-prepared than under-prepared to deal with this public health crisis. Our goal is to protect the health and well-being of all Madison County residents. I realize people are worried about this virus, and I want to assure you we are doing all that we can to be prepared. We encourage businesses, communities, and individuals to be prepared for the spread of this virus as well. Our county has response plans that address a range of possible scenarios. It is important that everyone do their part to slow the spread of this disease. Madison County residents are asked to avoid or postpone all non-essential activities to slow the spread of COVID-19. This includes all large public gatherings. Residents are asked to stay as isolated as possible to prevent the spread in our community. For those that are healthy, we encourage you to make deliberate actions to look after your friends and neighbors that have underlying health conditions. If you must go out, please see if they need you to pick up medications or groceries for them. I've always been proud to be a resident of Madison County due to the way we take care of each other, and I have no doubt that we will work together to get through this pandemic. Because COVID-19 is most commonly spread through respiratory droplets, you should take the same measures that healthcare providers recommend annually to prevent the spread of the flu or other viruses. Steps include washing your hands with soap and water for at least 20 seconds, avoid touching your face, cover coughs and sneezes, and disinfect surfaces frequently. Make it a point to disinfect doorknobs, light switches, and phones. Please remember social distancing. Try to keep 6 feet between you and others at all times. If you have a fever and a cough or difficulty breathing, call your healthcare provider. Please do not show up at any healthcare provider's office without calling first. Do not go to the emergency room. Emergency rooms need to care for the most critically ill. If you have a medical emergency, call 911, but be sure to tell them all of your symptoms. If you are a Madison County resident and do not have a healthcare provider, call our COVID hotline at 828-649-0755 to speak with a healthcare professional. I acknowledge this is a very challenging time, but I assure you we are taking these steps to try and prevent our medical resources from becoming overwhelmed. We're engaging in daily collaboration with federal, state, and local partners. COVID testing has been occurring at the Madison County Health Department for several weeks now. I remind you that all clinical services are confidential. You will be notified once we have a positive case, but no other details will be released to protect the privacy of our residents. Please know that we're all in this together. Your safety and well-being are our top priority. Thank you.
So if there's any questions from the press, we'll take those now.
This is a question for everyone, but obviously there's one individual up here that can best answer it. It's in regards to French Broad Electric. A lot of people are concerned, and this is a conversation I'll have with French Broad tomorrow, but if there's any information that you can share on what their policy may be as far as, it's obviously down the line, but maybe non-payment of bills, is that anything that anyone up there wants to address at this time?
Be best to contact Mr. Lovett, and he can give you all that information.
Tammy, there were 20 tests, or in the ballpark of 20 the last time we spoke. Do you have any update on the number of tests?
We still have tests that are pending, but at this time, Madison County does not have a confirmed positive case.
What's the turnaround on those tests?
Unfortunately, it is taking anywhere from 2+ to 5 or 6 days to get the results back.
What's the procedure for individuals that are tested after they're tested?
Repeat the question.
What is the procedure or process that occurs for individuals after they have received a test? For health departments, and especially for the Madison County Health Department, we have a limited number of tests, and are following the guidelines for individuals to be tested. So we don't test everyone just because they want to have a test. We test those that we assess to be at risk of having COVID-19. Once we perform the test, those individuals are quarantined, and all of our residents have agreed to self-quarantine and self-monitor. Should anything become worse, they will contact us. But they're quarantined until we get a negative test result back, so they're not out in the community.
What would you say to people that think that all these actions that are being taken nationally and locally are overboard? What would you tell those people?
What would I tell the people that think these actions are too much and that we've gone overboard? Working in public health, we look at stats and we look at scientific evidence. And so I'm not basing anything on Tammy's thoughts or how Tammy feels. There are clear cases that we have people all over the world that are very sick and are dying every day. The global infection rate passed 200,000 today. This is real. This is not something that I'm making up. And I want to do everything within the power of our community to protect our residents. And I would much rather that we be over-prepared and do too much as to do too little and have a negative outcome for even one resident.
What's the best way for individuals, this is a question for anyone, to get updates, hyper-reach notification, or what is the best way for people to get updates as they come in?
We have on the county's website a COVID-19 page that you can get information from. And on that web page, we also have what is called Reverse 911. And we are planning as needed to send out messages to people who have opted in. For example, if you have a cell phone, you will need to go to the website, opt in, put in your information, put in your cell phone number, so that if a notice comes out from the county through Reverse 911, you'll be notified. That's on our website, and again, that address is MadisonCountyNC.gov, and we have a COVID-19 page, and alongside there is a place for people to opt in to the Reverse 911 notification system. So that would be my recommendation, is the best way to get information.
Tammy, you've talked about how departments need to plan for mass absences. Louis, I was wondering if you would be able to address, Louis or Caleb, how medical services, fire services, first responders are planning for that potential missing staff.
Yeah, I can start. I can speak for 911 and our services to start with. We have all identified across all departments our core necessities, capabilities, what we really need to do at a very minimum level, and what we're going to do if we have to drop staffing, how we can still meet those needs for the community. It's different depending on each department, what those needs are and how much staff you need to achieve those goals, but we have a lot of other people in the county and government and the community excuse me, that can step in, so to speak. If we're down a couple people here, maybe a couple people that don't have as much work to do or something not essential can step in and help out. So we kind of have backups and backups to the backups.
What would you say to people? Madison County is really dependent on the tourist economy. What would you tell people either in the tourist industry or maybe thinking about coming to Madison County? How do you limit that at this time?
So the question is, how would we advise people that are tourists or in the tourism industry or considering coming to Madison County? The simple answer at this point in time is that if it's not essential, we're advising against that travel. We don't know what's coming next. This virus and the situation on the ground here and nationwide is changing very quickly. And so at this point in juncture, my advice, our advice as a group, is only essential travel.
Trash services are also something people are asking about. First, for you, is there, what's the plan in place, or is there a plan in place right now for
We are still, the question is, what's our plan as far as trash services? I know that from each of the towns that they're going to continue to operate their services within the towns. The county convenience centers and the landfill are all going to continue to remain open at least into the foreseeable future. However, that can change, and we do have contingencies in place, and I won't elaborate or explain that at this point. We will notify people if and when we move to a different phase as it relates to convenience centers.
Where would be the best information, or best way to find that information as it changes?
Well, we will post information at individual convenience center sites if we should choose and have a need to reduce services. We'll make sure that those are posted there, but it'll also be available on our county's website on the COVID-19 page.
Okay. Any mayors want to address that issue for pickup, trash pickup? Is that something that y'all are thinking about?
So during our meeting earlier in the week, we discussed it and we came up with that we're going to have mutual aid. So if our maintenance crews on our trash pickup days, if we got people out, we're going to provide mutual aid to each of the different towns, and we're going to continue to do what we need to do for the trash collection.
What are you telling your county employees, like specifically with trash centers? I think people are going there, maybe they're speaking with the collection center attendant. Is there a policy in place to stop the potential spread of misinformation or?
That's a good question. What are we doing to try to stop the spread of misinformation? That's one reason we're having this conversation today, and we are trying our best to put out facts and sticking to the facts. In our communities and throughout the nation, there are so many half-truths, mistruths, and untruths at this point in juncture. So my recommendation is let's all deal with the facts. If you don't know, call. We'll be sure and provide those facts to you, or go to our website, or go to the individual town websites and find out what is actually a separate fact from fiction. And I would say this, if I had the answer to that, I'd be a rich man.
Aid organizations in the county have obviously been taxed at this point, and maybe that will continue. Donations that they would typically do to grocery stores and things like that, there's no surplus right now, so that's putting stressing them. Have you talk about how you've been working with aid organizations, or what support you can lend them, or what support they can lend you? Is that a conversation that you're having at this time?
As far as the supply chain in the United States and in our area locally, we are seeing shortages, and that is of great concern to all of us. However, we have been able to solve some of the shortages that we've had, at least in the near term. And so we are sending in requests to the State Office of Emergency Management and to other areas throughout the state and federal government to look for resources to solve those shortages. We are doing everything that we can, and we will continue to do so to help provide the needs of our community.
There's no shortage of people that are willing and able to help at this time. What would you tell those individuals? How can their efforts best be put to work at this time?
The question is for people who are willing to volunteer. We do accept volunteers in the county, and we're going to need them. And I'm sure that the towns and Marshall University may need them too. But we at the county, for example, will take volunteers, and if you want to volunteer, you can call our hotline number and you can sign up. And so one thing that we are doing as a protective measure at our EOC, and as well as any volunteers, we are checking temperatures every day, so that if somebody comes and wants to work or wants to volunteer and they're showing signs of a fever, we're sending them home. So, but the number to volunteer again, 828-649-0755.
I know Mars Hill has talked about 24 dorm rooms potentially available for quarantine. Is that
I think that's still up in the air as far as how it's going to happen, because I think when we spoke the other day, some of those dorm rooms still have the students' possessions in there, so that's not going to happen. I would like to elaborate on what Mark was talking about the volunteers. We're also going to give you an ID badge. We're going to make sure we know who you are. So if we ask you to go help Ms. Smith or Mr. Smith, whatever, you'll be on our list. You've been vetted, and the person will know the right person's coming to help you.
How's the county budget changed a little bit at this time? Is there an adjustment on things that had plans to spend on that aren't happening?
And the question is, how has the county's budget changed? There's been no change to the budget at this time. We anticipate that there will be changes, and our top priority from the Board of Commissioners is to help our citizens get through this. And so we will make whatever changes we need to in order to help our citizens.
Are you postponing plans to make big purchases or anything like that?
No specific plans of that nature, but right now we have all hands on deck working on the COVID-19. And so most people are working round the clock on addressing the needs of COVID-19. So I haven't seen any purchase orders for any big equipment purchases except for things that are related to COVID-19.
Tammy, what would you tell a family with an individual that is showing symptoms? What's the best practice for that family to deal with that situation in their home?
First and foremost is to remain calm. 80% of those who contract COVID-19 will recover without any medical intervention. That doesn't mean that they may not need some over-the-counter medications, but don't panic. Call your primary care physician. If you don't have one, if you call our hotline, one of our nurses will be happy to provide you with some assistance and help walk you through steps. We want you to be reassured, but the most important thing is don't panic. The ones that we are truly concerned about are our at-risk population, which are those that's 65 and older and those with underlying health conditions.
Should that individual who has symptoms just stay in a room and people should isolate?
Well, it is cold and flu season, so kind of using some of the basic things that we know have worked for years. If you think you're ill, we absolutely would want to quarantine that person in a room in their home. Not officially the health department quarantining, but the family would want to try to isolate that person as much as possible. No matter what the illness is, you don't want to share it with everyone in your family. So limit having that person in the family room. If it's a child, try to find activities for them to do in their space, wherever that space is. But no matter what the illness is, let's try not to share it. Look for the fever, and if there's fever and cough, then we want you to call your primary care provider.
Where would you send where's the best place to look for healthcare resources? Questions on that?
If we definitely want you to look for information on COVID-19 from reliable resources. There's lots of things out there on social media that are not accurate and will not be helpful. But if you go to the North Carolina Department of Health and Human Services, as well as the CDC, they have the most accurate information, and that's who we work with on the hotline and at the clinic. We have direct lines, so if there's anything that's confusing or we're not clear about, they get us in touch with experts that can help guide our answers to our residents.
What would you say to those getting cabin fever? Teens in particular.
Oh, enjoy the time with your family. I think that we are so busy nowadays of doing sports and running and not having that quality time together. I know everyone doesn't have that opportunity, but if you have the opportunity to have dinner with your family, cook together, spend time together, and make the best of it. Find the silver lining in this.
There's suspicion maybe around certain people that may have it. What would you say about that?
Suspicion around people who may be diagnosed with COVID-19. Personally, I find that very hard to understand. Any person could contract COVID-19, just like thousands of people every year end up with the flu. That there should not be stigma attached to it. It could happen to anyone. It doesn't mean that, it doesn't have anything to do with financial status or cleanliness or anything else. It's just kind of a run of bad luck, and we would definitely want to reduce the stigma. Gossiping about who may or may not have it is not helpful. However, figuring out how we can come together as a county to meet our needs is where we need to focus all of our time and attention at this point.
Tammy,
Yes.
how many tests does the county have on hand?
We have a limited supply on hand. We are working with our private lab and with the state to try to secure additional tests. I also spoke directly with the CDC on Sunday. We have not had to not perform a test that we felt was a high risk due to not having them, but we don't have an abundance just to be using because someone would want that. There is also protocol in place that all folks getting a COVID test would need a flu test first, and we have discovered some positive flu tests in the last couple of weeks. So again, it is flu and cold season.
So you would get the flu test first if you have these symptoms?
Absolutely.
And then from there it would be determined whether you need to go on and have the COVID-19 test?
Yes, at the health department, we have the rapid flu screens, and so we can test those and quickly know if we have a positive or negative with your flu. And if it's positive, we know what's wrong and can provide the guidance to you. If it's negative and there are the symptoms there that concern us, you will get a COVID test.
So you can do the flu test right there in the office?
Absolutely.
And get the results right at the same time?
15 minutes.
Okay. And for folks, you're saying that currently there is nobody tested positive?
There are no confirmed cases in Madison County, so that is correct. None of the tests that we have submitted have came back positive. We still have tests that are in pending status, and I would predict that all 100 counties probably have a confirmed case. But the issue with COVID-19 is some people can have this virus and not know they're sick, and therefore that's the concern that they could spread it to those that are at risk. So it wouldn't surprise me one bit for there to be cases in all counties.
And what would you say to somebody wanting to come down and get a test? Do you have a procedure, or you want them to wait in the car before coming in, or just come into the office? What do you want to do?
Absolutely do not go into any medical facility if you have a fever and a cough or shortness of breath without calling first. We've established our hotline so we can triage calls and when they're staffed with medical professionals. So we want to triage the calls and see if we just want to wait and monitor from home, or if we do have concerns, you will be invited to come to the health department where we have procedures in place to get you the test and the assessment that we feel you need.
Would anybody like to address the hoarding that's been going on for toilet paper or alcohol? And I'm not talking about the drinking kind, I'm talking about the rubbing kind. Would anybody like to address that for the public?
The question is about the hoarding, what can we do? And the simple answer that we're going to ask everybody is take what you need, but don't take more than you need. Our supply chain in the United States has been able to provide our needs for many years, and they can again. But if we all go down and buy everything that's on the shelves today and keep doing that, the supply chain and businesses will no longer be able to do that. So the simple answer is, get what you need just like you always have, but leave something for your neighbor so that they can have their needs met too.
Right now, school has been closed officially for 2 weeks. Do you have any idea how the duration of these measures that are in place now, how long that may be in place?
The governor did declare that schools would be closed for a minimum of 2 weeks. And we, as I stated earlier, are in communication multiple times per day with the state and receiving guidance. So I know that's being looked at closely on a daily basis and would anticipate more news being available in the very near future.
I would like to add, our superintendent could not be here, but they have done a remarkable job of preparing and providing meals and taking those two students, and they also have done a remarkable job of developing online curriculum so that classwork can continue during this crisis. So I think that they'll be prepared if it goes longer than the 2 weeks.
How many senior meals have gone out on a daily basis?
The count I had yesterday was 160 a day. I'm anticipating that that number is going to continue to rise, and we'll be prepared to do what we need to.
Looking out, further out, what food resources are out there for folks?
Several of our agencies in the county are continuing to provide these essential services, the Beacon of Hope, and there's numerous ones in the county. The Y has contacted us. They've just changed the way they're operating. Instead of doing your own shopping now, they're going to have pre-boxed boxes available. We've also had some conversations with MANA about potential new distribution sites being opened. So right now, we are working to make sure that if there are needs, we're going to address those.
Cami, I'm taken away at how you have handled this so calmly. What advice would you give to other people whose anxiety levels rising?
The first thing, and you've heard me say this so many times, is that we just have to be calm. Overreacting and becoming hysterical is not going to help anything. If you get to be home right now with your children, again, take advantage of that. This is a very stressful situation. I completely agree with that. But let's all work together, and if you have a need, we want to meet those needs. So that's why the hotline's there. We don't want anybody to be hungry or to do without essential medications. But let's just slow down, and we'll get through this together.
I would like to say one thing about the hoarding. I think it needs to be said. Not only is it a point where you don't need toilet paper in this particular situation, when you go to a store and take all of those items, the people that you're hurting are our most vulnerable citizens. The three mayors to my left, I'm sure will back that up, when they take all of those items off, and then the elderly couple gets there and there's nothing there, that they need a few of those things, but you took 42 rolls of toilet paper. I think we need to understand that we're in this together. We need to be careful as far as this. I mean, we're lucky in this county to have the people in here that work as hard. These mayors care about their people. They know who they need to check on. They know exactly who needs that extra stuff. And we're willing to do that. But it's a little depressing to go into the stores and see the shelves that are gone, completely gone, knowing that there's no way a family of two needs two buggies full of toilet paper. So I would say, to your question, sir, get what you need, as Mark said, but understand everybody else needs something else too.
Today's Wednesday. A lot of churches around the county get together for Bible study and things like that. What advice are you giving them?
It is very clear, there's no thinking about it. For those that are 65 or older and those with underlying health conditions, we strongly recommend that they isolate as much as possible. There's opportunities in some of the churches for streaming. There are materials that they can use at home. For those that are going to be in church services, we definitely recommend lots of disinfecting. We recommend the social distancing. We are concerned with all of our residents, and when we're concerned about them, that's their whole being. So that is their emotional and mental health, their physical health, and their spiritual health. But right now, we're in a time that we've never seen before, so we're doing all that we can to protect every resident in Madison County.
There's also gatherings that happen often, wakes, something like that. Is there guidance around those types of events?
I have spoken with, we have 2 funeral homes in Madison County, and I've spoken with the funeral home directors at each. And sadly, we've had several deaths in our community in the last week. And, pardon me?
Not related to that.
Oh, correct, no, not related to the COVID-19. However, we have talked with them, and wakes are something that people love to hug on each other and just love on each other. And at this time, they have memos up discouraging handshakes, which come so natural, and hugs that come natural now. And they are practicing the 6-foot social distancing, and they have both stated that they would limit the number of people that were in the chapel or inside the funeral home at any given time. And I know that's really discouraging, and it's hard for folks, but it's in our best interest to follow these steps that we know can help us reduce this very contagious disease.
Where would you point people that need mental health resources at this time?
VIA Health is our managed care organization in the western part of the state, and they are still open, so if someone is having a mental health issue or concern, they are available. I don't have the number right in front of me, but it is known that folks that suffer from many mental health conditions are really going to have a hard time by self-isolating, especially depression. So if there's a true need, they can call VIA, and I would recommend that they find activities that they enjoy while they're in their homes.
This is a question for elected leaders. There's lots of political discourse around this issue. How are you locally working together or having conversations around this?
I think the fact that we're all standing up here together, you have your county's leadership up here. I mean, where nobody's here or there, we're all together. We sat around the table. We've talked about how we can help each other, mutual aid. I mean, I don't think we look at it as political. We're looking at it. These are our citizens, and we're going to take care of everybody in Madison County. That's all that matters. If we got to spend some money, we're going to spend some money. If we have to hurt some feelings, we're going to hurt some feelings. We're just going to get things done for all our citizens in our towns and in our county. I don't see it as political at all. So I think we're blessed to live in a place like this.
As a county manager, I've been really impressed with the spirit of cooperation and collaboration amongst our leaders, our elected officials, as well as the department heads. Everybody has come to the table with one goal in mind, is that what can we do to help folks in our community make it through COVID-19. With that being said, I would like to recognize we have one of our commissioners. He's been here. Matt Wecknell is back here, and he's been here for this whole time. So, Matt, I just wanted to make sure everybody knew you were here too.
You want to close us out, sir?
Anybody has any further questions, at any point in time, whether it be a citizen or a member of the community, we'd ask you to contact us at our hotline or call me as a county manager in my office. I'll be glad to help take questions. One thing I would add, and it's from Franklin Roosevelt, and that is the only thing we have to fear is fear itself. And that was what helped the greatest generation get through World War II. And I think it's appropriate in this day and age to help us get through this major catastrophe.
Thank you.
Thank you.
Thank you. Thank you for coming.